Hello, everyone, and good afternoon. Good afternoon. Welcome to the Lupus Society of Trinidad and Tobago live stream. We are so appreciative that you are here. Some will come later online, some said they will view after in the comfort of their home. They have some other things to do, but we are very happy that people are looking on. Today, we have a very special guest, and I'll introduce her later on. We haven't seen each other for a long time, so we say, hey, we are back here after all the little troubles we're having. We are still here live of the Lupus Society of Trinidad and Tobago. My name is Clifford. I'm your host for today, and I will bring it to you now our PRO, Dr. Judith McLeod James. She's going to share some very exciting news or information, whatever you want to call it, but it's exciting for us. So let's bring on Dr. Judith McLeod James. Dr. Judith, how are you?
Good afternoon, everyone. I am well. Thank you so much for having me.
Yes. So tell us what exciting stuff you have to share with us today.
Okay, I have such exciting news. I am excited just the thought of it. For the year 2026, we are having two major events I would like to share with everyone. One is our virtual 5K walk run. This is virtual simply because, as lupus patients, we may not have the energy to be out at sunrise or during the day and stuff like that. So we are encouraging you to share with your friends about this 5K. This is going to be over a 5 to 7 day period. As more information is available, it will be shared. We are working in conjunction with BAFA Sports. So you're going to see it on their website. We're going to share it with you where we can raise money for the society and for our rebranding. Shall I talk about the rebranding?
Of course, just give them a little teaser, right?
All right. You're going to see a new logo for the Lupus Society of Trinidad and Tobago when we have our launch. You're going to see vibrant colors. You're going to hear what they mean. You're going to see symbols. You're going to get a feel as to how we envision the society going forward. The logo encompasses all that the Lupus Society is all about: educating, sharing, supporting. And we're going to share this with you when we unveil it. So I am excited for that as well.
Yes, yes, it's a fresh new look, and we are asking everyone to get on board for this exciting new aspect of the Lupus Society of Trinidad and Tobago. We have been around since 1987.
Yes.
Yeah, and we need to have a logo to really exemplify the modern look. So Dr. Judith, that's exciting to know. And
Yes.
and the 5K. Now you can walk the 5K any time you want,
Anywhere, correct. You can walk it anywhere, you can run it
anywhere.
anywhere,
Yes.
as long as you log your time and you share that information with
Okay.
BAFA Sports. You will get your medal. We will have a medal available. So yes, those persons who are health conscious, we want you to share it far and wide so that we can have that support. We want to do this to educate the population that lupus is out there. Lupus is a disease that we have to manage, we have to be healthy about. And yes, we have to participate in some sort of physical activity as well. So yes, that's the first event. The second event, shall I go ahead and share that as well?
Of
That's
course, of course. That
great.
the second one. I like the second one. Go ahead.
All right. The second one is a glow fest. When we say glow, GLOW, glow. And we are hoping to have this one physical. This is a physical event where families can come, where
Right.
individuals can come, where communities can come, where we hoping to have a really fun time where we're gonna walk in the evening time where the glow can show up as it gets dark. The glow is going
Wow.
to show, and here we are going to glow for the Lupus Society again. It's for educational purposes, and we want to be a presence out there so that people can know about the lupus disease and how we can help each other, support each other, and then just give support to the Lupus Society in any way. We're going to have various packages available. We're going to have discounts available. We're going to invite um, stores to come. It's going to be a fantastic event.
Yeah, don't share too much, Dr.
Oh,
Judah. Don't share
okay,
too much.
right, right. You see, I got a little carried away. I got excited there again. But please listen to the news bulletin that comes out in the chat and online when we post so that you don't want to miss these three
Yeah.
major events.
All right. All right. Thank you very much, Dr. Judith, for sharing that exciting stuff.
Awesome. Yes.
Yes. Well, those are three exciting events that are going to take place very soon. Next year, we'll have the two events, the physical events. I'm just looking really for the glow because with lupus, you can still glow, right? It's not gloomy, it's glowing. So let's stay tuned, right? On our WhatsApp, on our Facebook, and you will hear more about it, right? At this time, we want to bring to you a very special doctor of ours, Dr. Marilyn Suite. And however you want to spell the suite, you can go right ahead because she is anyone. A very sweet doctor, right? She's an experienced dermatologist and she is really linked with the Lupus Society of Trinidad and Tobago for a very long time. So at this moment, I'd like to bring to you Dr. Marilyn Sweet, who will share with us lupus, hair, skin, nails. I don't know what she has in store, but let's listen on. Okay, so Dr. Sweet, now is your time.
Okay, so you're going to have to tell me what to do to share my screen.
Sure. Let me see here. Uh, if you can, it's on PowerPoint, right?
Yeah, PowerPoint. Yeah.
Okay. So, and you're using your phone right now to speak with us, or
No, I'm on the PC and PowerPoint is there.
okay? So great. So go to Microsoft PowerPoint, and you can see Start Show,
Okay, slideshow
or
from
or,
the
or
current
share screen.
slide.
Yeah.
Um, let's see, share screen. Are you seeing it now?
Nothing as yet.
Hmm, okay. Hmm.
Oh, let me see. Dr. Sweet, you want to share the information for me, and I can
What you mean?
like email it to me, and I can.
Um, it does is broadcast slideshow? Is that going to show it?
Try that one.
There's an icon that says that
Yeah, try that.
broadcast slideshow. No, you have to choose a service. Nope, that doesn't look like it. Um, I've done it on Zoom and that has never. Hmm. Okay, I feel I'm seeing it now, yes. Share screen. Um, um, hmm, right, got it. Good. Should have it now, do you? No? You have it?
Yes, yes, we have it, and I have it on the screen.
Okay.
Start.
And
Yes.
yeah?
Great, great.
Yeah?
We're good
Great.
to go, Doc. Take it
Yeah,
away.
lovely. So, good afternoon, everyone. As you know, I'm always happy to educate, and lupus patients always need to know and to keep being reminded about things that affect them as lupus patients. And today I'm talking about how lupus affects the skin hair and the nails. Some of you already know the classification that we tend to use when lupus affects the skin. First, acute lupus erythematosus, when patients suddenly become ill. There's subacute lupus, which occurs over a longer period of time. And there's discoid or chronic lupus, which many of you know may affect just the skin, and the patient is otherwise well. So just a little bit of a description here. In the case of acute lupus, the skin changes are of a sudden onset and often associated with systemic disease. So the patient is often otherwise unwell with fever, joint pain, weight loss, and some other symptoms. And acute lupus includes the butterfly rash, which occurs across the cheeks and the nose bridge, otherwise known as the malar rash. But it also tends to affect other areas of skin, especially the areas that are sunlight exposed, such as the neck, the chest, and the arms. And it can become generalized. Tends to show redness and scaling and is often itchy. But this form of skin involvement does not scar. When it resolves and the patient is better, it tends to leave a little bit of hyperpigmentation, that is darker skin than usual, but it doesn't scar. So here is a patient who has your typical rash across the cheeks and the nose bridge. And there it is red, and not a great picture, but it is also slightly scaly and a little bit raised. And here's another patient on the right who had more extensive involvement on her upper limbs. You can see a lot of redness and scaling, and it's mostly affecting the back of the forearms and hands, the areas that tend to be exposed to sunlight. In subacute lupus, the onset is slower than in acute lupus, and these patients are not necessarily ill at all. And if they do have some evidence of systemic disease, the disease is usually mild. It tends to affect the exposed areas of the neck, the arms, and the upper back. And the lesions are usually reddish in color, often ring-shaped or annular, as we say in dermatology, and scaly, and they tend to be worsened by sunlight. As the lesions heal, they cause discoloration of the skin. And there are some cases of subacute lupus induced by medications, such as an antihypertensive called hydralazine. So this is subacute disease. And you can see on the back of this patient a lot of ring-shaped lesions, some of them joining up to form these kind of map-like areas. And you can see that they all have this little edge to them. So this is typical of subacute lupus. In discoid lupus or chronic lupus, which many of you are familiar with, typical areas of involvement include the face and ears as well as the scalp. And when it occurs in the scalp, it often causes hair loss. It may be just in focal areas or it may become widespread. The lesions are often itchy, sometimes painful, and typically they are raised red patches that we call plaques. They're scaly, they're rough, they're often lighter color in the center, or darker on the edges, and when they heal with scarring of the skin. The majority of patients who have this particular type of lupus do not progress to systemic disease. And here are typical examples of chronic discoid lupus. Again, there is that lighter color in the center with a little pinkness and the edge being hyperpigmented or darker in color than the normal skin. In the patient on the left, it is on the neck, and in the other one, it's on the forearms. There are other ways in which lupus may affect the skin or what we call the mucosa, that's inside the mouth, and some patients may have mouth ulcers. You may also get involvement of the subcutaneous fat, particularly on the limbs, and this is what we call a lupus panniculitis or lupus profundus because it is a little bit deeper than the regular lupus. There's also tumid lupus, and these lesions are thick, often reddish in color. They do not scar, they are raised. You can actually feel the thickness of these spots, and this is what is called tumid lupus. Very rarely we may see bullous lupus, where the lupus presents with clear blisters. Then there's also chilblain lupus that looks like you've been exposed to cold, very cold, freezing weather, so it often will affect the tips of fingers and toes. But there are other changes that are non-specific, we call them, because it can occur in other autoimmune diseases like even rheumatoid arthritis. The palms may be red. And then there's Raynaud's phenomenon where the blood vessels will undergo vasospasm, so they shut down in cold, and the tips of the fingers and toes in particular get white because the blood vessels have closed down, then they turn blue, and then when the individual goes back into the warmth, they become painful and they start to become red again. There's also vasculitis, where the blood vessels are inflamed, and this can present with rash. Calcinosis is where there are calcium deposits in the skin, and this is abnormal because we don't expect calcium to be in the skin. Then there are rheumatoid nodules, which may occur in areas like the elbows. Urticaria or hives, which are often persistent. And then, of course, there are drug eruptions. So you can get skin manifestations of reactions to the drugs that the patient may be taking. So antimalarials, your hydroxychloroquine and chloroquine, we don't use much chloroquine anymore, can cause, for example, pigmentation of the skin, hyperpigmentation. Thankfully, that's not very common. And then there are the side effects of immunosuppression. So superficial fungal infections may be occurring on the skin when you're taking oral steroids and other types of immunosuppressants. You may get superficial fungal infections. So what should you do to help your skin? First of all, it's important to seek the diagnosis of lupus early and to get treatment started early. And we all know that lupus is made worse by sunlight exposure, so it's important to reduce your sunlight exposure as much as possible. Use your sunscreen. Long ago, when I gave this type of lecture, I would be telling patients to use a sunscreen of SPF 15. But now we know that we do need a little bit stronger The average individual should use an SPF of 30, but if you're sunlight sensitive, you should go up to 50, 50. And those products containing zinc oxide or titanium dioxide tend to give even better protection against ultraviolet A and ultraviolet B. You should use protective clothing and use caps and hats and head ties and so on whenever you can. Avoid smoking. We know that smoking delays the healing of chronic discoid lupus lesions. Use mild soaps for bathing and avoid using very hot water. Or people will say to me, oh gosh, well, I live in an area where I get up to bathe in the morning. That water is so cold. Yes, we understand that, but don't use the water very hot. You take the chill off so the water is comfortable, but don't use it very hot. And of course, be compliant with your medication. Use it as the doctor prescribes. It's good to take a vitamin D supplement as well, simply because you're staying out of the sun. A lot of people already, even before a diagnosis of lupus is made, they're often vitamin D deficient because they're spending so much time indoors with their jobs and so on. So it's good to take a vitamin D supplement. Next, we move on to how lupus affects the hair. And I think almost everybody must be familiar with the word alopecia, which means hair loss. And alopecia by itself is not a diagnosis. It may be a symptom of a condition, and there's generally a cause attached to that hair loss. So the word alopecia by itself is not a diagnosis. The patients with lupus may have diffuse alopecia, and by that we mean that the hair loss is occurring from all over the scalp. It may be as a result of having the illness itself, as often lupus is a chronic disorder with a lot of what we call relapses and remissions. So one minute you're well, the next minute you're not so well. And what happens when you are unwell is the hair does not complete its normal growth phase, which is normally as much as 3 years long. And it goes quickly into a resting phase, and then it is lost. And hence this hair loss all over the scalp. But sometimes there's lupus rash in the scalp, in the situation when you've got systemic lupus. You may see dark scaly areas within the scalp, or even redness and scaling, but this is not the sort of localized patches of chronic discoid lupus. It tends to be a kind of all over change. Also, you may get hair loss due to the medication itself. And the immunosuppressant drugs, especially if you use things like methotrexate and some of the other drugs, then the hair may fall. But this form of hair loss is not scarring, and when the patient is better, or if drugs, medication is changed, then the hair tends to regrow. You may also get localized alopecia or localized hair loss in areas of active lupus. And when the patches heal, the plaques heal, there may be scarring so that the hair loss is often permanent. So here is on the left is a patient with the diffuse hair loss. And I think you can appreciate the sort of dark discoloration that is occurring in her scalp. We also have what we call the lupus hair. You're familiar with the lupus hair, where the hair changes texture. So an individual who had classically tightly coiled African type hair will tell the doctor that the texture of my hair is changing. It has got really very soft. And you can see this patient, the edges of her hair, they're very soft and wispy, and then the hair further in is more coiled. In the picture on the right, you can see the discoloration of the scalp that I mentioned before that occurs with discoid lupus. And here is another patch, discoid lupus, that has practically healed already, but no discoloring, in the sense that large areas there have no hair growing, and it has also been left with this discoloration. Hypopigmentation, we call it, but some of the areas are also darker. So this is what happens with chronic discoid lupus in the scalp. What to do for hair loss? Well, remember I said before that the hair tends to recover when the patient is better, but often the hair is not always fully regrown. It may still be a little bit thin. It's important to treat the discoid lesions if they are occurring. And if you're ill, you really must take your treatment on time and make sure that you complete the treatment as prescribed by the doctor. But scarring is permanent in cases of chronic discoid lupus. If we get to treat those patches early, to be honest, hair often regrows, even in chronic lupus, discoid lupus, but often scarring is permanent. One should use mild shampoos and conditioners, which help to improve the hair texture, because some patients complain that the hair is sort of wiry in texture. Protect the scalp from sunlight just as you protect the skin. So, by the wearing of hats and caps and using an umbrella when you're outdoors in sunlight. There are sunscreens that could be applied to the scalp because they're sprays. So you part the hair and you put the sunscreen into the scalp. Make sure that the diet is adequate, because there are other factors that may contribute to hair loss. For example, iron deficiency and vitamin D deficiency, even protein deficiency if you're cutting back on your protein intake, if you don't eat meat and so on. There may be other things occurring, for example, kidney disease, that may contribute to the hair loss. So supplements may be needed. A patient with scarring alopecia may need to wear a wig or use hair extensions to hide the hair loss. And now we move on to the nail changes. Discoid lupus may affect fingers and toes, and therefore affect the nails. And you can see in this picture, there is redness and a sort of a thick scale there at the base of the nail, with the area we call the nail fold. And even so, nearer to the tip, there's this thick, hard area, which in this case represents discoid lupus plaques affecting the fingers. And when this happens and there's a lot of inflammation going on, it may disturb the growth of the nail, so the nail may break and the nail may actually fall out. And depending on the amount of scarring, the nail may not regrow at all. Then there are what we call Bowes lines. This is a non-specific change that can happen in any serious illness. So a flare of lupus, or even something like a flu, a severe flu that puts you in bed, or major surgery, can cause Bowes lines. And Bowes lines is this sort of horizontal groove going across the nail. And it often also gives us an idea of when the flare occurred or when the illness occurred. And in this case, where it's halfway across the length of the nail, it tells us that it probably occurred about 3 months ago, because a fingernail takes roughly 6 months to grow from end to end. So there's interruption in nail growth during the illness, and then as a nail starts to grow normally again, this groove develops. Then the nail fold capillaries may be dilated. So there again, at the base of the nail, in the area that we call the nail fold, You can see dilated small blood vessels called capillaries. It may be possible to see these with the naked eye, but sometimes we use a little light to show them up. Then there's what you call the red lunule, and the lunule is a sort of half moon shaped area just again at the base of the nail, and that's called the lunule, and it is often red in lupus patients due to dilated capillaries. Splinter hemorrhages also occur, and you could see those as little vertical reddish brown lines under the nail plate. And some of those are non-specific changes that may be seen in patients with other autoimmune conditions, including things like dermatomyositis. The nails may have fungal infection, and this may be a complication of being immunosuppressed. As with the skin, what can you do? Again, treat the lupus specific lesions affecting the hands and therefore and feet, and therefore the nails. Protect the hands when you're doing a lot of wet work. So use gloves for that kind of wet work. So dishwashing, laundry, washing the car, even cooking where your hands are in and out of water. Using gloves would help. Moisturize the hands as often as possible, including the area around the nails. Avoid injuries, and of course, have a good proper diet. So there are other changes that may occur in lupus patients, for example, if there are complications. So patient taking higher doses of steroids for long periods may develop easy bruising, but you may also get bruising if you have a low platelet count from lupus itself. Some of you are familiar with the term thrombocytopenia, and that's when the platelets are low. You may have itchy, dry skin if you have renal failure. And some patients may have other disorders occurring at the same time that they are having their lupus. They may be diabetic, and they may develop diabetes even as a result of the steroid. They may also have autoimmune thyroid disease, which if they're hypothyroid, the skin is often coarse and dry. Many of the issues affecting the skin, hair, and nails are easily treated, so it's important to report those to the doctor, be compliant with the medications, and also inform your doctor of any changes that you're experiencing. Most importantly, make a list so when you get there, you have you don't be struggling to remember. So thank you very much. I hope this lecture was useful.
Dr. Sweet, I'm amazed of the information you shared there. You know, especially with the hair, the skin, and the nails. I remember seeing someone dear to me about their nails like that. And it was so surprising. You mentioned and you showed photos. So I think our lupus members and also those who are looking at the World Wide Web who are non lupus members, when they see the loved ones or their friends having those symptoms, they're more aware of what's happening and don't be too frightened or too much anxiety. Uh, this was a very, very important presentation, Dr. Sweet. Thank you so much. I appreciate the time you
Do you
spent with
think
me.
anybody has any questions they want urgently answered?
Ah, great. So the doctor is willing to answer your questions. Anybody who would like to ask a question, send it on your YouTube, and we will bring it straight into the digital studio. So let's wait for a few minutes to see any question. But Dr. Sweet, your presentation was concise, and simple. Um, and I learned some stuff from it too. I didn't know some stuff. Uh, like today, I received a call from someone and they were asking about certain things, and I couldn't answer. And I said, uh, please join the society and you can talk more with other lupus patients who have the experience, who are on the drugs. It's not terminal, Every one of us has a terminal time, but it's not terminal. Okay, so I'm looking to see if anybody. I think Dr. Suchi was clear and concise.
So
They
no
said
question, no questions needed.
yeah, they said two things in a presentation. One, they didn't know anything you said or understand, and the second one, it was so easy. But I think it's the second one because I learned there was no big words. Uh, there was very few medical jargon, and Dr. Sri, how may I ask how long have you been a dermatologist?
Oh, let me do the math. I would say about 40 years,
Oh my! So you know the skin to the bone,
so to speak.
so to speak. Okay, there is a question here. Let me just put
Okay.
this one up. It
Okay.
says, "What about nails that separate from the bed of the finger or toes?
Yeah.
Is that
Okay.
a lupus
Yeah.
issue?"
All right. So that separation of the nail that's separating from the bed, we have a term for it in dermatology. We call it onycholysis. Onycho being the word for nail and lysis meaning separation.
Okay,
And it can be for many reasons. It may be part of the whole scenario of inflammation in the nail bed that's during active lupus, or more commonly, it may be as a result of fungal infection, um, secondary to long term steroid use, that immunosuppression. So there are different reasons for that separation.
yeah,
And in some cases, there are people who have wet jobs. There's some doing just housework all day, or somebody who may be a bartender, or interestingly, we have surgeons whose hands are being scrubbed every time, often. They are susceptible to that separation of the nail from the nail bed. So it may be simple, easily fixed things like keeping the hands dry and using some kind of drops, or one may actually need to go on an antifungal agent. We see
okay,
separation of the nail bed in conditions like psoriasis as well, because the inflammation is occurring in the nail bed. It causes the nail to separate from the nail bed. So there are quite a few different reasons.
oh, okay, okay. Doc, I like the aspect of when you mention no smoking.
Yeah, there's definite evidence that cigarette smoking, and no doubt marijuana will fall into it too.
Anything with
Um,
smoke,
any
vaping
smoke,
as well, right? Vaping as well,
any
right?
smoke. I don't know of articles with the vaping,
Okay,
but I
okay,
mean, one could probably extrapolate and say it probably is the case.
okay,
Yeah. So it seems that there can be some retarding of the healing, because we all know that nicotine kind of closes down the blood vessels and so on. So yeah, smoking does reduce healing, especially in chronic discoid lupus.
wow, wow. So today we touched the hair, the nails, and the skin. Three important parts, especially for women. You know.
Don't
Uh,
worry, mental.
yeah, but when I go Pennywise, I mostly see women, right?
I tell you, but don't worry. The men sent their women to shop. Don't worry.
Oh my, that's some truth. That's some truth. Well, Dr. Sweet, I want to say appreciation from the Lupus Society of Trinidad and Tobago for what you just shared with us. I know it's very important. Some people learn, not some, we all learn today, and now we need to apply it. And that you can never overemphasize, and I heard you say it in most of these slides, that please take your medication as
Yep.
prescribed.
Yep.
That's very, very important. Thank you for the 40 plus years of service, Dr. Sweet. Much you have impacted society. And we want to tell our those who watching online, please share this video. It will be staying on YouTube and our YouTube channel, so you can see, share, save, and support as best as you can. Do have a wonderful evening, and stay safe, stay blessed, and we see each other next time for another Lupus Society free online session. Bye.
Bye.